Abortion on demand at any gestational age could be coming to the state of Florida in November unless the pro-life community and the church engage to defend God's preborn in the womb. Today, April 1st, 2024, the Florida State Supreme Court gave the green light for a constitutional amendment to be on the ballot this November. The constitutional amendment is called Floridians Protecting Freedom and is primarily sponsored by the ACLU of Florida and Planned Parenthood, who have poured millions of dollars to make abortion on demand at any gestational age the law of the land here in the state of Florida. Let me read the constitutional amendment to you. It says, "No law shall prohibit, penalize, delay, or restrict abortion before viability," which most states would say is between 22 and 24 weeks. We're saving babies' lives by giving them blood transfusions as early as 18 weeks, yet this would allow for abortion up to viability. But then it continues, where it will say, or when necessary to protect the patient's health as determined by the patient's health care provider. Well, first, how is health defined? Health was actually defined in 1973 in a case called Doe versus Bolton. It was released the same day as Roe versus Wade, and it defined health as physical, emotional, psychological, familial, and age, where the mom might be too young, too old, has depression, has anxiety. Her mom doesn't want her to have a baby. Dad doesn't want her to have the baby. It was so broad there were really no restrictions as far as what health meant, and also as determined by an independent council or group of physicians? No, as determined by that patient's healthcare provider, which is broad. Is this doctors, nurses, nurse practitioners, medical assistants? Who knows? It just says health care providers. This is evil, and we cannot stand for this. We are created in the image of God at the moment of conception. This is an attack against that image of God, but this is also an attack against patients' rights because we treat the preborn as patients in the womb. In addition to doing blood transfusions, we are now performing open heart surgery to save babies' lives, where the baby and the mom both had an anesthesiologist for their surgeries. But we're also doing spina bifida corrective surgery, laser vascular surgery, and even brain surgery for babies in the womb to save their lives. A patient is a person, no matter how small. We need to get engaged. Get your church involved, get your pro-life friends involved, and educate your friends on what Floridians Protecting Freedom is. This is not protecting the rights of my patients. Moms are important and moms have rights, but so do those babies inside of the womb. We need to meet the needs of these moms, help them through this challenging time, but not have their help equate to just killing their babies, my patients in the womb. This is horrible. We need to stand up. If it garners 60% of the vote, it will be the law of the land here in the state of Florida. We have legislatively brought the abortion gestational age cap from 24 weeks down to 15 weeks, and in 30 days it goes back down to heartbeat. Let's not go backwards. This is a spiritual battle, and Satan is leading this. Satan was also leading a spiritual battle 2,000 years ago when he and his minions thought they had won because Jesus was dead. Jesus was dead on Friday and Saturday, but then came Sunday, and that's what we just celebrated. Resurrection Sunday, when Jesus conquered death and he conquered the grave and he rose from the dead. We can win this battle. We just have to engage. We need to be engaged in prayer. We need to be engaged in discussion, and we need to defend God's preborn, my patients in the womb. I'm Dr. Bill Lyle. If you have any questions, you can contact me through my website, which is prolifedoc.org. God bless you all, and God bless your efforts as you defend God's preborn, my patients in the womb.